So let's jump right into it. Let's talk about how to inject testosterone. So to inject testosterone, you're going to need your medication, and testosterone comes in a couple different forms. As an injectable, there's this one called To Testosterone, and it has 100 milligrams per ml. There is this one here, which is testosterone, just a different brand, and it's also 100 milligrams per 1 ml. And then we have deletestrol, which is a more concentrated medication, so it's 200 milligrams per ml. You will also need to inject 1 to 2 alcohol swabs. You'll need a syringe and a needle, and you'll need an additional needle to draw up the medication. As well, it's important to have a sharp spin to just dispose of your syringes and needles to keep them away from any pets or kids, and just for safety in general. So let's start with looking at the medication. You should always inspect the medication to make sure it looks correct. Most testosterone injectable medication will be an off-white, yellowish color, and you want to make sure there's no cloudiness and no particulate in the product. So you can see it's transparent, so you can see through it, and it's a slightly yellowish liquid, and there's no particulate in the medication. All testosterone products available in Canada that are injectable are suspended in oil. So make sure you don't have any allergies to cottonseed or sesame oil, because that tends to be what they are suspended in. Because it's suspended in oil, we're going to use a larger needle to draw up the medication because oil is very viscous. So what that means is oil is thicker, which means it's harder to draw up the medication because there's more force behind the liquid. So we're going to use a thicker, a lower gauge needle, which means the needle opening is wider, to draw up the medication, and then switch to a smaller needle that's more appropriate for injecting. So the medication is going to have a cap, and under the cap is a rubber stopper. The rubber stopper is where you're going to push the needle through in order to get the medication out of the vial. So for this demonstration, I'm going to use sodium chloride, which is just basically a liquid. I will note that this is going to be a lot thinner than testosterone, so it's going to be very easy for me to draw up. But when you draw up testosterone, you may notice that it's very thick. You have to push a little bit harder on the syringe to get it out of the vial. So the first thing you're going to do is you're going to take the lid off of your medication, and you're going to expose the rubber stopper. These testosterone vials are multi-dose, which means you can use them several times. Once you start using it, it's good for 28 days. And after 28 days, you will discard it even if there's medication left. So I will also prepare my needle. So this is the needle I'm going to use to withdraw the medication, the thicker, longer needle. And I'm also going to remove my syringe from the package, but I'll leave the other needle in there for now because I'm not going to use it yet. So let's open up one of these needles. I'm going to attach it to the syringe. So usually they attach just by twisting. And then I'm going to uncap it carefully because it is a needle. The caps can sometimes be quite sticky to the needle. And I'm going to throw the cap to the side for now. I'm going to draw up as much air as I'm going to inject of medication. So typically a testosterone dose will be between 0.5 ml to 1 ml of liquid, and it'll be written on your vial and on the label on your vial. So I'm going to draw up as much air as I'm going to dose. So let's say my dose is 0.5 ml. I'm going to draw up 0.5 ml of air, and then I'm going to inject that 0.5 ml of air into my testosterone. Okay, this is to help reduce the pressure in the vial and make it easier to draw up. So I'll spin it around, push in the air, and then what I'm going to do is I'm going to make sure the needle tip is in the liquid. So make sure it's not poking out of the liquid. You want the needle tip to be in the liquid so you don't get any air bubbles. And then now that it's in the liquid, I'm just going to draw up the syringe. You're going to want to draw up usually beyond the amount you need, so beyond 0.5 ml. because you might get air bubbles, and you can see here I have one air bubble. I'm just gonna flick the side of the syringe to get the air bubble to rise to the top, and then I'm just gonna push it out. So I'm gonna push it out. I see there's one more air bubble to the side here. Gonna try to get it. And if you have air bubbles and you can't quite get them out, that's okay. So I have one here by the syringe. You can just push all the medication back into the vial and start again. I'm gonna try to get it closer, see if I can get it out. Sometimes they're very sticky.